All right, so with the global coronavirus pandemic, gripping many parts of the world, here in South Africa, there's issues with regards to hygiene, issues with regards to water, and just generally overcrowding. So how are people coping? I want to take you now to KwaZulu-Natal. It's where we find my colleague Ayanda Mhlongo. She's at a hostel where residents there are concerned with regards to their living conditions. Ayanda, a very good morning to you. What are you learning at the stage at the hostel? Where exactly are you? And tell us about some of the concerns that residents they have.
A very good morning to you, Blaine, and good morning to our viewers. We're coming to you live from the Dalton hostel here in the Durban CBD. Of course, it's one of the many hostels that are here in the city of Durban and around the city of Durban. And as you said, Blaine, that one of the issues that has been stressed in one of the measures, rather, the precautions, is hygiene. That around the world and here in South Africa, the government, the health department have been stressing the issue of hygiene. Now, we've been receiving through the week calls from residents at a number of hostels, and particularly this hostel where we are, and the concerns that they have put forth, that they too want to also adhere and want to ensure that there is a clean space for them to live. But there are serious concerns, Blaine. We are right in the heart, in the middle of a Dalton hostel. There are about 1,500 beds, so this area is supposed to occupy at least 1,500 people, but we are told that the number of residents that are living in this hostel are in fact double or even more that number, around 3,000, we are told from some of the leaders here at the hostel. And shockingly, Blaine, is what we found here in that in one of the rooms, and we're going to be moving to this room and now as I move towards, just to give our viewers an idea and for them to see what the hostel residents are concerned about and what they are saying. This is one of the rooms here in the hostel. I'm just going to quickly take you through. Of course, there are some people who are sleeping, so we're going to try and avert them. But Blaine, in this room are 16 beds, and as you see, they are very close to one another. And this is the concern that hostel dwellers are saying, and they're saying that they've been raising the issue of overcrowding, and they're saying that as much as one person might want to ensure that they sanitize, they wash their hands, very importantly is the social distancing, but they're saying how can they keep the social distancing if they are living in these crammed spaces? Just look at the distance between this bed and this bed. If anyone were to contract the COVID-19, particularly in this area, as much as they may be able to keep themselves clean, as much as they may be able to put masks, but inevitably they are going to be moving around here, they are going to be touching one another. The meter distance as well, as you can see how close the beds are to another, they aren't going to be able to adhere to that. And also one of the concerns is that while one person might saying that they're very concerned about the coronavirus and they're doing everything in their power to ensure that they take all the necessary precautions, the person sitting next to them or sleeping next to them might not or feel the same and not want to take these precautions. And so they're saying that it's very scary for them. It's such a difficult situation for them, and how are they going to be able to ensure that they are safe, to ensure that this area is kept hygienic when there's so much overcrowding. We're going to bring in now one of the leaders of the hostel. He does not only lead the community here at Dalton Hostel, but he also represents Ubonye Bama Hostel, which is an association representing all hostels here in KwaZulu-Natal, but more specifically here in Durban, and that is Mr. Mthemseni Thusi. Babthusa sibonga kakhulu nje isikhathi sakho namhlanje kuseni usilethelana hostel baba, ngoba niyakhalaza nani njengabahlali ukuthi njengoba sesibonile ukuthi abantu baminyene kanjani nayo indawo yokuhlanzeka akukho, mhlawumbe kusibekele kunini ukuthi yini kakhulu enikhala ngakho.
I think our concern is this about the virus is that at our hostel we are overcrowding, which is very, very hard if you look at the distance which we are supposed to be, or 2 meter apart. So it's not easy to follow the instruction. And also our problem is that we need somebody who can come in and just give us an assistance to give us a workshop what is about and how we can protect ourselves. And also the problem is we need to wash our hands each and every time. But our problem is that we don't have enough resources, for example, sanitizers and also the gloves and so on.
You're sharing these. We've just spoken to some of the residents here, and some are saying, well, we accepted it, that if it comes to us, it looks like we are going to die. So residents have been coming to you really, really seriously concerned about the coronavirus.
I think the resident concern, even ourselves, is that we don't know exactly what is going on, because we only read that on a paper and also seen on TV and listen on the radio. Our concern is even a community is to have a municipality or MEC to come and give them this thing to tell them that what is about, how they can protect themselves. If we can have that, I'm definitely sure that we are going to have we are not going to have that disease. Our problem is that if you look at the population of our residents, that we are too close. So we are scared if one of our residents is affected, because it tells us that that thing is going to spread. Then if it spread, we don't have resources. For example, we don't have enough nurses, we don't have enough doctors, we don't have enough hospital to accommodate especially the hostel residents. Because if you compare the number, we got Dalton, we got 9 hostels. They all got huge number. So if one of the residents get affected, that is going to give us a big problem.
Thusi, are you saying, and I know that you've been going around trying to speak to as many residents here as possible, areas as well. I know that we've been receiving calls from KwaMashu. I was just speaking to you before we came on air about that. One of their concerns is also the water cut. So aside from the overcrowding, what are your other challenges? I know there are some hostels that have been complaining that there's been water cuts in those areas. And so they are saying, how are we supposed to keep clean? How can we wash our hands if we don't have water?
That is all the challenges that are facing with the municipality, because we keep complaining about a water problem. Unfortunately, they don't. I can just put like that. They don't do their job properly. That's why we always having a march against me, because of their lack of maintaining the hostel. So if you look at we talk about the overcrowding now. We've been marching several times about overcrowding. Unfortunately, they didn't assist. That's why we are facing. We are in this situation today.
Thusi, all right, thank you so much for your time there. I'm Mthembiseni Thusi, one of the leaders here at the Dalton hostel. As we move across, as you were saying, Blaine, that some of the challenges that they have is that they're trying their utmost best as leaders to spread the word, to speak to as many residents as they can about hygiene, about ensuring that they wash their hands, but they simply don't have the resources. The other problem is that they want health workers to come into the hostel. They're asking that they be provided with sanitizers, they be provided with gloves and whatever other resources that are being used and that could assist residents that are living here. Not only here, as he said, there are 9 hostels, all of them of which are overcrowded. One of the biggest hostels, I think there the number's about 20,000 or so, is the KwaMashu hostel. And again, there we've been receiving calls too of concerns from those residents. And Blaine, just another issue that we picked up. If you let me have the hostel dwellers are workers that they work. They are taxi drivers. They are housekeepers, domestic workers. They are truck drivers, and so their jobs put them at risk. These are the jobs where they're in constant contact with a number of people, and this is what Mr. Thusi was trying to stress with us, that these people go out to jobs that are risky on their own, and then when they come back here, there is this threat of them that if one contracts COVID-19, it will be very easy for them to spread across these hostels. Blaine.
Yeah, it's going to be very difficult to adhere to the social distancing protocols when you have 16 beds in one room. Ayanda, thank you very much indeed for your reporting. We'll try to catch up with you a little later on to get more reaction with regards to these new regulations, what it means for the ordinary South Africans there, and how people are adapting to these new regulations. Thank you very much indeed, Ayanda Mhlongo, live for us in KwaZulu-Natal. So, talking about these new regulations with regards to selling of liquor. So according to the new regulations, the all off consumption premises selling liquor must be closed between 6 in the evening until 9 in the morning, the next morning, and on weekdays, that is, and Saturdays, and then from 1 o'clock on Sundays and public holidays. So we want to know, what's your thoughts with regards to this at the agenda_SABC. Also, schools, according to the new regulations, should have closed on Wednesday, the 18th of March. Do you know of any schools that are still open? We'd love to hear from you in terms of this. Send us your thoughts at the agenda_SABC. We're going to give you a telephone line as well. We'll try to put it up on your screen very shortly. So tell us, are there any schools? Do you know of any schools that are still operating when it was supposed to be closed on Wednesday? At the agenda_SABC. Well, in